Thank you for joining us on Help with Answers. I'm Matt Arnsdorf, a lung cancer survivor and patient, and I'm here today with Dr. Ross Camage. And we're going to continue our conversation about CBD, THC, marijuana, and how it is used in lung cancer treatments. Okay. Can we start with talking about how it can be used, what it's good for, and maybe what's still not proven as for symptoms or possibly a curative approach?
So, we said there's THC and CBD. So the CBD tends to work best for the symptoms that we associate with cancer and some of the treatments for cancer.
Okay.
So it works for lack of appetite, it can work for insomnia, it can work for anxiety, it can work for pain. I've had some patients that be able to come off their opiate painkillers. It can work for nausea. The thing is, it's just a drug though. I mean, it works for some people, and just like any other painkiller or anything else, it doesn't work for everybody. So it's just another tool in the armamentarium that we can use.
Okay.
The THC has pretty limited medical role, I'd say. I mean, there are people who've pushed the very high THC form, so there's something called Rick Simpson oil, as a treatment for cancer. And I think there's a tiny bit of truth in that, but if you think about all of the developments in lung cancer, it's all about personalized therapy. Yes. So why should there be one treatment for every kind of cancer? It doesn't make any sense. I think that's just wishful thinking.
Okay. So if someone was interested in starting to use CBD or THC as another tool in their lung cancer treatment, how would you want them to approach you? And then let's also talk about how they can go about getting it, where they should get it from, and then also how they should go about using it, methods of edibles, smoking it, vaping, what's the best options out there?
So in states where it's legal for both recreational and medical, as in Colorado, I mean, technically you don't even have to go see your doctor. You could just go in and get the stuff recreationally. The difference between recreational and medical is the price. It's essentially the same stuff or the same range of things that you can select. If you go the medical route, you go to your doctor, and I don't prescribe it. I don't get out my prescription pad and say you need this and this dose and this often. Okay. All I do is fill out the details so you can get an ID card so you can get the reduced price.
Sure.
I mean, my biggest worry though is then you go into a dispensary and somebody who may have no medical knowledge, may really just be up to speed on their recreational aspects, is then the person saying, oh yeah, you need this one.
Yeah, sure. What are some things we still don't know about CBD and THC and its uses?
Well, I mean, it's a really long list.
Sure.
So the fact that there are, this is a natural product. There's an analogy that's a bit like saying, your doctor says, you should have some alcohol, and you go into a liquor store and they say, the doctor said I should have some alcohol, what should I get? Yeah. And the guy behind the thing says, do you want beer, do you want wine, do you want liquor, whatever. So we're kind of at that state. Which strain of marijuana do you take? How do you take it? Generally speaking, I would suggest you take something orally. I think smoking it, vaping it is a bad idea. These are very sensitive tissues in your lungs. It can be a solid gummy or a candy. It can be an oil, which allows you to be very sensitive. You can get it as creams, but that's only going to be an issue if you've got like an achy joint.
Sure.
I think the other things we don't know is, what dose do you take? How often do you take it? Sometimes these things can get into your system very quickly. Ones that the oils tend to get in quicker. Some people even rub it on their gums, which get into their system very quickly.
Sure.
But if you do that, if you don't know that aspect, you can overdose really quickly. I ate one square of the chocolate bar. I think nothing's happened. 20 minutes later, I ate the rest of the chocolate bar, and then 2 hours later, I'm completely stoned. So all of this is unknown and desperately in need of study.
Definitely. What about drug interactions? If someone wants to find out if the treatment they're on, the targeted therapy they're on, how it works with marijuana, where should they go for that information, or who can they ask?
Well, what we're mostly worried about is when two drugs, and marijuana is a drug, are metabolized, are broken down in the body in the same way, and they're going to interfere with each other. So they're either going to increase the levels of one of the drugs or decrease them. And so the best place to do is to go to your pharmacist in a cancer center and say, look, I'm thinking about starting this. I'm already on these treatments. Is that okay? And I think that's the best place to start. But it goes back to the idea of, don't do the experiment this weekend and then tell your doctor that you did it. Say, hey, this weekend I'm thinking about going to see a dispensary the first time. What should I look out for?
Okay, perfect. Do you have anything else to add that you want to touch base on this?
Well, so here's my question. So have you taken marijuana?
I have, many, many years ago, obviously not as a treatment option.
Okay. But I think what I really like is that you answer that question directly. And this has been a sort of taboo subject for a while. And if the patient asks me, have I taken marijuana? I smoked it once, it had no effect. I was on a canal boat with some friends who were stoned out of their head, and I was the one left driving. It's a true story. Then you have to be able to address it up front without being awkward about it.
Sure.
And that's what maintains trust.
Perfect. Okay, well, thanks for your time, and thank you for joining us on Hope with Answers.